Hi, everyone. I'm Carmen McLean, and I'm going to be talking about a pilot trial of a mobile app for an exposure-based mobile app for post-traumatic stress. So let me start by noting I don't have any disclosures. Let me start by sharing a little bit about this app. So this is a self-management tool, and the main features of this app are two different kinds of exposure. So there's in vivo exposure, which is approaching trauma-related situations in real life. And then there's imaginal exposure, which involves revisiting a memory of traumatic event. We did in the app, we did kind of a written exposure, or they could use talk to text. And then there was also there's also a self-care component, which is primarily relaxation and behavioral activation. And then sort of, I think, unique to this app is a social support feature where the user can invite other people to be on their support team. And the other persons will receive their own version of Renew that has psychoeducation information about trauma, about exposure, and about how to be a good support to the user. And the support person gets notifications whenever the user earns points or achieves a new level in the app. Basically, when they engage in the app, the support person is notified, and they're instructed to send a message that's kind of supportive or encouraging. Idea being to use the person's sort of natural support network, try to promote engagement with the app, because engagement is often a really big challenge with mobile apps. So I want to tell you a little bit more about the app. I'm just going to go on into detail about one of the features. So this is in vivo exposure. It's called Approach in the app. On the left-hand side here, you can see there's some instructions about how to build a list of situations that the user would like to be more comfortable doing. So there's some sample lists that they can see. They get instructions of how to kind of think of, come up with a good situation. They're rating their distress. When they select a situation and they start doing the exposure, there's a timer. They have access to tips for how to stay engaged, how to not, do subtle avoidance that can make it less effective. They can also review their motivations, which is a section of the app where there's quotes and there's videos and all different kinds of media that the user can select and kind of personalize to be motivating for them about why they want to work on their recovery from traumatic stress. And then the data about their distress ratings before, peak, and after each exposure exercise is tracked so that they can look at patterns over time and hopefully see reductions occurring. All right, so let me tell you about this. I want to tell you about the study that we did. This was a pilot trial. Basically, the first aim is we wanted to see if this would work, if this would help people reduce PTSD symptoms primarily. And I don't know of any other apps for PTSD that include exposure, which is a really, really an effective psychotherapy technique. And so we're just curious to see, would this work? First question. And then the second question was really about this social support piece. And we wanted to see if that, as we had hoped, would be, helpful in terms of keeping people engaged and maybe improving outcomes as well. So we recruited the social media campaign. We recruited 93 veterans with clinically significant PTSD symptoms. And we randomized them to receive the app kind of as is, so they could use the social support feature if they wanted to. And then some people received the app and we had them add a research staff person as a support team member so that we could kind of ensure that there was some of that happening. And then there was a wait list group as well. And we asked people to use the app just for 6 weeks, a fairly short use period. And then at that point, the waitlist group began using Renew. And we didn't have, you can see here, we really did not have much dropout from this app, which was from this study, which was nice. I'll just want to point out here, we were recruiting any veterans with PTS symptoms. We ended up recruiting predominantly women veterans, which was kind of interesting. About 2/3 of the sample was white, fairly even distribution on these other demographics. Okay, so here's what we found. So this is PTSD symptom severity, and the black line is people that were using the app during that 6-week period. This is the waitlist group during that same period, and then at 6 weeks, here's where the waitlist group started using the app, and here's where they're using the app over the next 6-week period. So the app use, this reduction and this reduction was a significant reduction. The interaction right here was not significant statistically, but it was a small effect. And our aim about, our hypothesis about the support feature was a complete bust. We did not find any differences in terms of engagement or outcomes at all. But this was a pilot, and of course we wanted to do some exploratory analyses. So we conceptualized support in a couple different ways. We looked at the number of support messages that the user received, and we found that that also was not related to engagement. But what we did see is that the number of support people that the user added, so excluding the research staff person, was associated with more time in the app, more time doing exposure, and more points, these different sort of indices of engagement with the app. So there's maybe, something there. The other thing we wanted to look at is what are people doing in the app? So overall time in the app was not related to outcomes, which I think is similar to what some other PTSD apps have found as well. But what we did see is that engagement with the exposure components specifically was associated with PTSD change, which as an exposure therapist really just made my heart happy to see that finding. And I think that's a really, really exciting result, preliminary result. Okay, so in conclusion, we found this sort of small effect for PTSD reduction over a 6-week period. The symptom reduction was kind of comparable to what's been found for PTSD Coach, which is a really well-researched, great app for PTSD. And I think based on our kind of follow-up pattern and also from findings of studies of PTSD Coach, I'm now thinking we really should have had a longer use period. And if we had, we might have potentially seen a larger effect. As I mentioned, our support manipulation did not work at all. But so my interpretation is, I think the users just weren't that moved by messages received from essentially a stranger. The research staff person is essentially a stranger, but that there might be something about the user disclosing to their actual friends and family, hey, I'm engaging in this app and I want to work on my post-traumatic stress and I want your support, that there's something potentially useful about that. Really exciting finding about the exposure engagement specifically being linked to change. And we collected some qualitative data I didn't have time to include here, but basically people were generally quite satisfied and found a positive impact for using the app. And then the one limitation I want to note really quickly is that the data were collected in like a 3-month period around the summer of 2020, which I think is kind of like the height of when there was, there's no vaccine on the horizon. There's a lot of uncertainty and fear. So not clear really how that would have impacted things, but I think safe to say not in a positive direction. And that's it for me.